The Canadian vaccine plan, by the end of March, 3 million Canadians should be vaccinated with the Pfizer and Moderna products. Then in April, there's supposed to be something called the ramp up. But Canada's supply of the precious medicine is way behind other countries, including the United States. President-elect Joe Biden, he's going to be inaugurated this Wednesday, says the U.S. will vaccinate 100 million people in 100 days. Now, that would dwarf the Canadian numbers per capita, and that explains why some Canadian snowbirds are literally flying down to places like Florida to get a vaccine more quickly. Canada, for example, has vaccinated about 1.3% of the population. The U.S. already 3.5%. Israel's past 20%. So how did the U.S. get so many doses so fast, and can they really get 100 million people done so quickly? With COVID expected to kill 400,000 Americans, what's their plan for the rollout? Let's get new details now. Joining me now is the director of the U.S. National Institute of Allergy and Infectious Diseases, the chief medical advisor to President-elect Joe Biden, and one of the leading members of the Trump White House's coronavirus task force. You know him, Dr. Anthony Fauci. Dr. Fauci, a pleasure to have you on the program. So President-elect Joe Biden plans, he says, to administer 100 million vaccines in his first 100 days of office. That starts Wednesday. That's 50 million Americans vaccinated. Is that a realistic goal? How is he going to get that done?
I believe it is. The president-elect has put together a plan that when you look at the plan, the relationship and collaboration between the federal government and the local facilities, the states, the cities, and the local areas where the vaccine will be administered, looking at the plan and discussing it with the team, I feel that this is an eminently doable goal.
Here in Canada, there's a debate about the time between the first and second doses. Manufacturers like Pfizer and Moderna, respectively, have said 21 and 28 days apart. In Canada now, we're actually moving towards 42 days apart, and one province, Quebec, 90 days apart. What's your view in the U.S. is the best time and the safest time between the first and second dose for maximum efficacy?
Well, what we've done is that we've made our decisions based on the data that was available through the clinical trials. So let me give you an example. The clinical trial of Moderna, as well as the clinical trial of Pfizer, was done under the following conditions. Individuals got a primary dose, and then for Pfizer, 21 days later, they got the boost. For Moderna, they got a prime, and 28 days later, they got the boost. So the data that we got that showed the 94 to 95% efficacy is based on the data from the science and the evidence that we have. So we don't have any data about what it would mean if you extended it another month or another 2 months. So I can't argue for or against it, except to say that we're following the science of the evidence that we have.
Okay, so you're saying that if you wait another month, 42 days, 50 days, maybe up to 90 days, there's no evidence that would work because that hasn't been tested. Would you then advise a state that's worried about the outbreak and worried about volume, if they said to you, we're going to wait 42 days or 52 days between doses, would you be concerned about safety or the efficacy of the vaccine?
I certainly would not be concerned about safety, but of course, if you increase the duration between doses, if there would be any effect, that would likely be the effect on efficacy. And quite frankly, and in fairness to the Canadian approach, we don't know whether that would be less effective or as effective or more effective, because we don't have any data in that regard.
Let me ask you another question about people who have already recovered from COVID. In your view, are they immune now, or can they get it again, and should they get the shot?
Well, we certainly are not telling people who've been infected not to get vaccinated. We feel that everyone should get vaccinated. If you were infected, we don't know the duration of the immunity. We could not know it because we're so early into this experience with this outbreak that if a person has been infected and has recovered, they can get vaccinated. The real question is, how long should they wait from the time they've recovered from infection to get vaccinated? And there really is a lot of discussion. Should it be 90 days? Should it be 60 days? Should you wait 30 days? Not really any good data about how long one should wait.
Let's talk about these mutations we're hearing, Dr. Fauci. There's a UK strain. We're hearing about a strain in South Africa and one in Brazil. First of all, how worried about these are you? Are you concerned that the Moderna, the Pfizer, and potentially other vaccines might not be effective? And if the vaccine rollout, Doc, goes too slowly, could these new strains undermine this whole vaccine rollout that we're doing?
Well, I think if you go first and go to 40,000 feet and look at the situation that these viruses are RNA viruses, they tend to mutate. The more replication of virus there is, the greater the virus has a chance to mutate. So the easiest way to get things under control is to suppress the replication of virus, which means decrease the amount of infections in the community. The original data that came from the UK said that they're fairly certain that these mutations are associated with a greater degree of transmissibility, which indicates the sharp spike that we've seen in the UK, particularly in the southeastern part and in London. They are telling us that it doesn't have any impact on the virulence of the virus, namely it doesn't make the virus more serious in the sense of making you more sick or having you get a greater chance of dying. And thus far, there doesn't appear to be any impact on the vaccine-induced protection. However, this is something you have to watch very carefully, and we're looking at that ourselves because that's the one thing you want to pay attention to. Does it negatively impact the vaccination effect? We are hearing from colleagues in South Africa that that's a more problematic set of mutations, that already it's showing that it's escaping the protection from certain of the monoclonal antibodies and even possibly from the vaccine.
Given the previous experience, would you then tell Joe Biden, the president-elect, look, we don't know a lot about this, but we're worried about mutation. We should close borders to South Africa now. We should close the border to Brazil just to prevent that mutation from possibly entering the country. Would you advise that?
Well, first of all, the virus is already in the United States, the UK version. The more we look, the more we see. It isn't the dominant strain, but it's here. We're looking for the South African strain. Once a strain gets into a country, it will spread if it is a strain that has a high degree. So right now, we're not talking about that. Though whenever you're looking at things that are unanticipated, you always consider everything and anything on the table. But I do not see any major serious discussion right now about closing borders.
Dr. Fauci, here we're hit. The second wave's hitting hard. You've got our most populous province of Ontario under a stay-at-home order, emergency measures. You've got Quebec on a curfew. I'm looking at the states where you guys are facing closing in on 400,000 deaths. Given the nature of this, the slow rollout of the vaccine, are these things like stay-at-home orders, lockdowns, curfews, do you support those as effective measures to stop the spread of the virus?
Well, as Canada is a very large country, we have a large country. We have 50 states and additional territories, and people tend to do things differently depending upon where they are. So if you have a degree of infection that you want to shut down a bit, for example, California is going through a very difficult situation with just about being stressed as far as you can with healthcare delivery and personnel, particularly people who are requiring intensive care. So a governor of a state like California might make a decision to shut down, in the sense of stay at home, to various parts of the state. That is generally a decision that's made at the local level. I would doubt that we would be hearing about a broad federal type of a shutdown. But again, you have to take this on a day-by-day, week-by-week basis and respond appropriately to what the situation is on the ground.
Dr. Fauci, how long do you predict this is going to last? That's the question everyone wants to know. We've got the vaccines. We're not sure when Johnson & Johnson and AstraZeneca might get approved. How long is this darn pandemic going to go on? And I guess the follow-up question, sir, is once it's done, do we have to get a vaccine year after year from now on against this stuff like the flu?
Well, in answer to your last question, that is going to depend really on the durability of immunity, but also if in fact these types of mutations evade the protection of the vaccine. If it does, we may need to, and this is certainly a possibility, monitor the evolution of the strains and modify the vaccines accordingly. In answer to your first question, if we are successful in getting this under control with a vaccine, which is certainly feasible to do, but it would be dependent on the percentage of the population that gets vaccinated. We've made an estimate, and we can only make an estimate because you have to have years of experience to know what the real percentage is. But the estimate is that if we get 70 to 85% of the population vaccinated, you would create an umbrella or a blanket of herd immunity over a given country. Certainly in the United States, we've estimated this, so that by the time we get to the fall or winter, that we likely would be able to achieve some degree of normality, because you've got to logistically get all these people vaccinated, and that in and of itself is going to take several months. And by the time the immunity sets in, we're going to be well into and beyond the summer.
Last question. You're working now with President-elect Biden. You've advised him to do new things. But, sir, working with Donald Trump, we all watched it. I mean, you're a guy that's been awarded the Presidential Medal of Freedom by George W. Bush, the National Medal of Science, the Time Magazine's Guardian of the Year. But Donald Trump has periodically called you a disaster, threatened to fire you. How hard was it to work with a president who downplayed the virus, who undermined and sowed distrust in the scientific evidence as you watch literally hundreds and hundreds of thousands of Americans die? How difficult was that for you?
Well, it certainly wasn't easy. It would have been better if we had a consistent messaging, but that's what you do, you work around. We had a team, the White House Coronavirus Task Force, that was focused very, very much like a laser on getting the job done, of getting the message out. So in answer to your question is obvious. It is not easy when you're trying to do that, and a president is saying things that seem to be downplaying your capabilities, to put it mildly.
To put it mildly. You always put it mildly. But, sir, I really appreciate your time and the work that you've put in to try to control this deadly virus. Thanks for speaking to Canada Today, and I appreciate your time, sir.
My pleasure. Thank you for having me.
All right.